So, welcome to Adverse Effects Explained. This is a short lecture series I started a while ago to make lectures on pharmacology, focusing on the adverse effects of different drugs. So, today we are going to discuss a drug. You may have heard its name, hydralazine. It belongs to the nitrate family of drugs and it is used in the cardiovascular system to control blood pressure under some circumstances. So let's get started. Hydralazine is a nitrate that acts on vascular smooth muscle via the cyclic guanosine monophosphate pathway to cause vasodilation. Now, the cyclic GMP pathway, you may have heard its name, is the pathway that is NO mediated and nitric oxide mediated, and there are many drugs which act via this pathway to cause vasodilation in different arteries. So hydralazine also acts this way, and as a result, there's a decrease in the blood pressure. Now, the key distinction of hydralazine from other nitrates is that while nitrates act on veins preferentially, hydralazine acts on arterioles. Arterioles, because it acts on arterioles, it leads to afterload reduction. Now, this is a key point I want you to remember because this key point is going to affect the applications and adverse effects of hydralazine. Uh, I write the important information in my slides in italic form, which is the stylish form. So if you just want to, know about the extra information in my slides, you can focus on the lines which are in italic. So arterioles account for most of the total peripheral resistance in our systemic circulation, and because they account for most of the TPR, they lead to a decrease in blood pressure. So the clinical uses of hydralazine range from severe hypertension, particularly acute. It is also given in heart failure along with organic nitrate. Hydralazine is safe to use during pregnancy. You may have memorized the mnemonic by now. New moms love hugs. So the four antihypertensives that are safe during pregnancy are nifedipine, methyldopa, labetalol, and hydralazine. So hydralazine is co-administered with beta blocker to prevent reflex tachycardia. Why it is given with beta blocker? Because it is going to cause reflex tachycardia. We also studied that in the calcium channel blockers lecture, and it causes reflex tachycardia via the aortic and carotid body baroreceptor reflex. Now we are going to start the adverse effects of hydralazine. The first effect is the compensatory tachycardia, which is also seen in CCBs, which is also seen in nitrates. Now the compensatory tachycardia is via the baroreceptor reflex, as we discussed in the previous slide. Hydralazine is contraindicated in coronary artery disease and angina versus nitrates, which are the preferable agents to give in CAD and angina. And the reason for this is mentioned here, that in angina and CAD, local vasodilatory mechanisms of heart are already causing modest vasodilation. Now, as a result of this vasodilation, there is this selective vasodilation of the narrow or occluded vessels in the heart, which are restoring the blood flow to the myocardium to some extent. Now, if we give hydralazine to such patients, to patients with angina or CAD, it is going to cause the diffuse vasodilation of the entire coronary arterial system. Now, as a result of this, the blood flow will be shunted from the poorly perfused myocardium to the well perfused regions of the heart. Now, this is also called a coronary steal syndrome. I forgot to mention that here. But the consequence of this, lapse in clinical judgment would be catastrophic. Hydralazine also causes fluid retention. It causes retention via the uh, you know the renin angiotensin aldosterone system, which is mediated by the kidneys. A decrease in blood pressure leads to a decrease in the renal blood flow to kidneys, as a result of which kidneys increase renin secretion, which in turn increases the production of angiotensin 2, and which angiotensin 2 in its own turn uh, stimulates the aldosterone secretion from adrenal cortex, and this aldosterone in turn causes increased sodium and water retention, which causes the fluid retention here. Now, hydralazine also causes headache, and we discussed in the CCB's lecture that headache is a common symptom of drugs which act on vessels and vasodilate those vessels. You may know that migraine itself is caused by vasodilatory mechanisms, and hydralazine also causes angina. Now, drug-induced lupus. Drug-induced lupus is something that is very poorly understood. The mechanism behind it is only postulated. There are some studies which have been done, and some results which have been concluded, but there is no conclusive evidence of why or how hydralazine causes lupus. A postulated mechanism is written here that the oxidation of hydralazine causes the formation of some reactive species which covalently modify some nuclear proteins, including histones, and or it damages the cells. As a result of this covalent modification, there is a release of new neoantigens and pro-inflammatory signals, which leads to autoimmunity. Now, hydralazine is cleared in part by an acetylation in liver. There are people who are called slow acetylators, who have a decreased uh, enzyme concentration or some gene mutation which causes a decrease in the clearance of hydralazine. And so if there is a increased concentration of hydralazine, there is an increased risk for autoimmunity in such people, and there is an increased risk for drug-induced lupus. So our lecture sums up here. Thank you very much. Leave any suggestions if you want. Thank you.